SAPHIR-02 is an academic trial. It's a huge effort at the national level in France. It's a randomized trial regarding maintenance treatment. So 999 patients were screened. It means that all these patients started an induction chemotherapy. At the time where SAPHIR-02 was designed, the induction chemotherapy was only a platinum-based chemotherapy without immunotherapy. So the patients received 4 cycles of induction chemotherapy, and meanwhile, large analysis by NGS and CGH was performed on the archived tissue or on a new biopsy that could be done before the 3rd cycle. The molecular results were analyzed through National Molecular Tumor Board twice a month. And if there was a molecular abnormality, the patients could be randomized between a specific targeted therapy or standard of care. If there was no targeted the patient was randomized between durvalumab or standard of care, and these results regarding immunotherapy has been already reported at the ESMO last ESMO meeting. So at ASCO, we have reported the data of the targeted therapy maintenance arm compared to standard of care. The standard of care was mostly Pemetrexed maintenance, since 86% of the patients randomized had adenocarcinoma. The patients randomized had to be EGFR wild type or ALK negative. It explained that the rate of never smoker is very low, 5.1%. So the patients could receive one of the 8 different targeted therapies. Among them, we could find a MEK inhibitor, and it was the drug, for example, that we gave for the KRAS mutated NSCLC, an mTOR inhibitor given, for example, in case of STK11 mutation, a MET inhibitor, a PA3K inhibitor, a FGFR inhibitor, a pan-AR inhibitor, a PARP inhibitor, and an anti-angiogenic drug. 175 patients were randomized between standard of care or targeted therapy. Of note, we have exactly the same breakdown in terms of toxicity between the standard of care and the targeted therapy. Unfortunately, the targeted therapy did not bring any benefit. The PFS was 2.7 months from the randomization point, meaning after 4 cycles of induction chemotherapy in both arms. The median overall survival was 14 months in both arms. So overall, the trial is negative, but it proves that at a national level, a very large trial with central comprehensive molecular panel done is something that is feasible. Today, with the new targeted therapy, like the specific KRAS inhibitors, of course, we would have designed differently the trial, but the concept is there and valid.